Good afternoon, and welcome to NAMI New Jersey's weekly webinar series. My name is Maggie Luo, and I'm the Associate Director in Communications and Technology from NAMI New Jersey. Today's topic is crisis planning for families. As we know, crisis episodes related to mental illness can feel overwhelming. This webinar will provide family members and caregivers with tools to help their loved one during a mental health crisis. We're very honored to have a wonderful panel of speakers, Jennifer Hughes, Juliet Hyndman, and Aaron Doherty joining us today. I'd like to briefly introduce them here. Jennifer Hughes is an Associate Director of Program Quality Assurance at NAMI New Jersey. Jennifer began her career as a social worker working with youth and families in a social setting. As a licensed clinical social worker, Jen has training in psychotherapy, crisis intervention, and program management evaluation. She completed the Middlesex County Crisis Intervention Training for Law Enforcement and is a member of the CIT committee in Middlesex County. Our second panelist, Aaron Doherty, is a patrolman in the Woodbridge Police Department. Aaron participated in crisis intervention training in Middlesex County as well as in San Antonio Police Department. He is now an active listening and role play instructor for the Middlesex County CIT class and sits on its planning board. Aaron has also participated in events as a panelist speaking about the Sequential Intercept Model. Advocating for individuals with mental health issues is a personal and professional priority for Aaron, and his mission is to improve the police response. Our third speaker today, Juliet Hyndman, serves on the executive committee as first vice president of NAMI Warren County. Juliet is a NAMI Family-to-Family Course graduate, a NAMI Smarts for Advocacy teacher, and represents Warren County for NAMI New Jersey's Northern Region Family Support Act Workgroup. Juliet and her husband, Dr. Arnold Hyndman, have 4 adult sons, 2 daughters-in-law, and 4 grandchildren. They are co-pastors of Navah New Covenant Fellowship, which is a home-based Hebraic Roots Christian congregation. So Juliet, Aaron, and Jen, we're so grateful that you are here today speaking about this important topic. I will now pass it on to you, Jen.
Thank you so much, Maggie, for the wonderful introduction. I'm very excited to be here with Juliet and Aaron. So we are going to get started on crisis planning for families. So as Maggie mentioned, this is a workshop to provide family members and caregivers with tools to help their loved one through a mental health crisis. During this workshop, we hope that you'll be able to identify triggers and warning signs of a mental health crisis, identify tools to help your loved one in a mental health crisis, understand how to respond to law enforcement, and consider ways to prevent a crisis. So what is a mental health crisis? A mental health crisis is any situation in which a person is at risk of hurting themselves or others, or if they're unable to care for themselves or function actively in the community. Warning signs of a mental health crisis. So some examples of warning signs of a mental health crisis include inability to perform daily tasks. So some of this may be lack of hygiene. Someone might not bathe or brush their hair or brush their teeth. Some other signs include increased energy level, inability to stay still, withdrawn, isolation, also losing touch with reality. So if there's any type of confusion or they think someone is there that's not, or hearing voices, seeing things that are there that's not there, these are all signs of a mental health crisis. Triggers. So what is a trigger? A trigger is something that someone can feel or it's something that causes someone to feel or act a certain way. So there's 2 different types of triggers. There's external triggers and there's internal triggers. External triggers are usually sometimes easier to see in a person. So this can be caused by people, things, or places. And there's also internal triggers, which these can be harder to see. and this can be related to feelings, mood, or physical illness. Some examples of external triggers are changes to family structure. So an example would be if there was maybe a divorce or a family member left the house, loss of any kind. So this can be a death, but also, you know, where we are in this situation with this pandemic, loss of normalcy can be a trigger for someone. Substance and alcohol use, legal trouble. So if someone has to go to court or they've been arrested, changes in relationships, such as a breakup, maybe not talking to someone anymore. Conflicts with others. So if they're not getting along with their friends, their family, constantly arguing, volatile, that can be an external trigger for them. Exposure to trauma or violence. So if they see something happen within their community, that can be an external trigger that makes them feel a certain way that may put them into a crisis. Internal triggers. So like I said, these are sometimes harder to see, but as a caregiver or a family member, it could be possible that you can identify some of these internal triggers that your loved one is experiencing. So sleep patterns changing. Is your loved one up all night? Are they not able to get out of bed? Are they sleeping too much? Medication changes. So that if you know there's a medication change, that can be causing the crisis. Feelings of loneliness, previous trauma, disruptive thought process. So do you know that they're having a delusion or a hallucination? Can you, are you able to see that, or do you see their mood or behavior change because of that? Okay, so let's move a little bit into what do you do when your loved one experiences crisis? So I want to first speak about suicidal ideation. So we talked about warning signs of a mental health crisis. Now, what if you feel that your loved one is at risk for suicide? What are some signs of this? Giving away personal possessions. So if there is something that you know is so important to your loved one and you see them give that away, that could be a sign that they may have a plan for suicide. Also, withdrawal, sudden cheerfulness or calm after a period of depression. So this is a sign that if someone has been depressed for a long period of time and they show this cheerfulness and it's just a different type of personality than you've seen, it can be a sign that they have come up with a plan on how they will attempt suicide. Saying things like nothing matters anymore, you'll be better off without me. Those are also some signs of a suicidal ideation. Something else is history of suicide attempts. So if your loved one has attempted suicide in the past, that is one of the top signs that they will attempt suicide again. So let's say you see some of these signs, you're worried about your loved one. How can you respond to these warnings? So you can ask questions. Don't be afraid to ask your loved one if they're having thoughts of hurting themselves or killing themselves. Sometimes it is hard to ask that type of question to someone you love, but that they may be surprised that you're asking, but may give you a clear answer if you're asking directly the question. Are you having thoughts of killing yourself? Do you have a plan to kill yourself? Also express concern, listen, active listening skills, reflect. So let's say your loved one is saying, it's not worth it to live. I don't want to be here anymore. Reflect back to them and show that you were listening. So by saying, it sounds like you're feeling really hopeless. I'm worried about you. Let them know that you're here. Say there are options available. Recovery is possible. How can we work together to get you the treatment and the help that you need? So there are some different response options if you do feel that your loved one is unsafe or safety can't be assured or you're just unsure. What if you've tried some of these things, you are able to identify their triggers, but you just would like another you would like further assessment for your loved one. So some options are calling the mental health provider, so calling their provider, contacting a mental health crisis response team. So there's mobile response, a mobile screening center, go to the emergency room, contact a respite house near you. So what is a respite house? A respite house is a place that is for individuals with mental illness that are experiencing a crisis, but is not a threat to themselves or others. So this is a place where they can go for some comfort. There are other peers there, there's counseling opportunities, and respite houses are throughout the state. They do have a limited number of beds, but this can prevent a crisis, from prevent your loved one from being hospitalized or going into further crisis. Also calling 911 and asking for someone with mental health experience, such as a crisis intervention officer. We are going to go into this in the next couple slides where Aaron will talk a little bit more about this. Okay, so as a caregiver or family member, how can you help your loved one in this situation? Try to take a deep breath. Keep your voice calm. Listen to the person. Ask how you can help. Offer options instead of taking control. Be patient. Don't make judgmental comments. Now, I know all of this might sound difficult to do when you see your loved one in crisis. All you want to do maybe is sit there, and your instinct is, I just want to make everything okay. I just want to hug you, or it's okay, things will get better. You know, you want to resolve the situation for them, but sometimes just listening to them and keeping your voice calm can go a long way. Now, I do want to ask our panelist, Juliet, to speak a little bit about her experience on how she helps her loved one, or in the past has helped her loved one when they were in a crisis situation. Juliet?
Sure, I'd be happy to, Jen. My experience has taken about a 20-year process. And so in the very beginning, it was, I had no skills. I had no idea what was coming on. My experience and my cultural background didn't prepare me for mental illness in our family, although there was some evidence now that there was, but we were not equipped whatsoever. Psychiatry was a field that was very, it was a stigma. That's the best way I could describe it. So, we've tried to be calm, but again, especially with a first time occurrence or crisis, it's really hard. And so for those of you listening in the audience, the state of mental illness and mental health has really improved within the last 20 years. And the fact that we're having this webinar is evidence of that. And so I would recommend availing yourselves to a lot of resources through NAMI and your local mental health department, because they have the resources. But definitely all of the advice that's up on the screen are very helpful.
Thank you so much, Juliet, for sharing that.
You're welcome.
Okay, so let's say you have tried a lot of these things. You identified triggers, you see some warning signs, you've tried to ask your loved one questions, you've listened, you've expressed this concern, but you're still, there's still not safety that can be assured. So it's time to call 911. When safety can't be assured, the person is in danger of hurting themselves or others or property, or there's an immediate life-threatening situation. So what happens when you call 911? What should you keep in mind? If this is a mental health crisis, you want to ask for a crisis intervention team officer. So someone that is trained and has mental health experience. And some key things to say are, this is a mental health emergency. Threats have been made or not. If there's weapons involved, has there been a history of violence, and what your loved one's current diagnosis and what medications they're on. So as much information that you can provide the dispatcher will help when the officers arrive at your home. So what I'm going to direct this actually to Aaron so that he can talk a little bit about what the difference is between a CIT trained officer and not CIT trained officer. Aaron?
Yes, well, thank you very much. So basically, when you call 911, you ask for a CIT trained officer. You're essentially setting the tone for the interaction. You're letting the dispatcher know that you have someone in your house who's suffering from a mental health crisis and that you're expecting a different level of care when they arrive. CIT in particular, it trains officers how to effectively identify a mental health crisis, how to effectively guide the individual to the safest path possible, and ultimately try to avoid using force, which is really the main goal. Things such as active listening skills, which is what I taught. We really teach that it is a skill, and some officers are really good at it right off the bat, and some it takes time depending on their level of interaction. Other things are signs and symptoms of a mental health condition, specifically ones that could manifest in a dangerous way, and other resources that are available. A lot of times our main goal is to stabilize the situation, and a lot of times that means taking someone to a crisis center if the crisis has gotten to that level. And other times it could mean taking a step back, listening to the individual, finding out what their level is, and maybe they don't need crisis they don't need a crisis service right away. Things like CIT teach the officers you can leave information with the family. This person's in crisis now, but it doesn't reach a level where we need to take them to the hospital or against their will to a crisis center. Maybe we can come back in a few days and we can follow up with the individual, see how they're doing. It's ultimately a different approach than the normal police encounter. So that's why it's very, very important, if you have a loved one who's suffering from a crisis, that you set the tone right away and you ask for a CIT trained officer. And even if there's not one available, you've relayed the message that you want this interaction to be handled in a different way.
Thank you so much, Aaron. So, Aaron just spoke a little bit about what the CIT officers are trained in. And now what we're going to speak about a little bit is when law enforcement comes out, how do they respond? So what is their role in this situation? You called 911, you requested a CIT officer, Aaron comes out. He takes charge, he assesses the situation, and he becomes the decision maker. So he may decide a crime has been committed. He may decide hospitalization is needed and places a hold to transport. Or he may decide that the person does not need hospitalization and will recommend additional resources, such as a respite house, going to a wellness center, talking to a mental health provider. These are different options. So I'm going to have Aaron talk a little bit more about being this decision maker and his role in this situation. Yes, so Aaron, please. Thank you.
Yes. So again, when people call 911, it's because they have faced with a problem that they themselves don't think they can handle, right? So when the officer comes, there's already that tone. So immediately, it's our job as police officers to stabilize the situation as quickly as possible so that nobody gets hurt. And a lot of times that could immediately come off as, the officer just comes off a little overbearing and things like that. But you also have to understand, whatever information was given to the dispatcher is all they have going into the house, right? So it's our job to immediately take charge of the situation. In the decision-making, there's, examples, domestic violence. This is the question that comes up a lot. Why was my loved one taken away and arrested if they committed a crime due to their mental health condition? I just wanted to point out real quickly that the domestic violence laws in New Jersey are very, very strict. And if a certain crime has been committed, such as a simple assault or a serious destruction of property, things like that, then it's usually a mandatory arrest situation. I just wanted to put that out there because that's usually a big question that we get. Yeah, like we said before, if the situation is so out of control that we need to, immediately take someone to a crisis center, that's usually, what we're going to do. And again, the CIT officer has more training to be able to, stabilize the situation, maybe calm the person down a little bit better, so that way you don't have to go to the crisis center. Yeah, I think that's about it for that.
Thank you, Aaron. I do want to also ask Juliet if she can speak about her experience when she has had law enforcement involved, and talk a little bit about that.
Yes, I'd be happy to. One point I wanted to make earlier on was that it would be helpful, because based on my experience, what I've learned is that when we call 911, it goes to the county dispatcher, and then it's relayed to the appropriate municipality. In my case, we're serviced by the state troopers. So we've learned that it's very helpful to get the direct line for whatever police force that services your community, because that circumvents any kind of communication breakdown. Because in our situation, our loved one ended up being arrested because of that. Another point is it's very difficult, because when you call 911 or wherever for a crisis, one of the questions they ask is the person, is he or she at risk of injuring himself or to others? And and they'll ask information, and in our situation, our loved ones behavior was escalating within the month, and so naturally we were very concerned, and so I would describe things that our loved one was doing, and the dispatcher would articulate or interpret that as some kind of aggressive behavior, and so that could set the tone as well. And so on the one hand, as a caretaker, you're trying to balance, you're trying to get help, because the more urgent your call is, the faster they'll respond. But then if you give too much information, it will point a different scenario and put your loved one at risk. And so and even in our situation, I kept reiterating that this is a mental health crisis, a mental illness. My loved one has, this diagnosis, but yet it was treated a different way, because just as Aaron said, once they hear that the behavior is described as some kind of domestic violence behavior, they put on that hat. Well, fortunately, our officers have been trained in CIT now. It wasn't the case back then. This was in 2013. So unfortunately, we had to go through that, but I'm at least thankful that it's not the case anymore. But I hope that helps.
Definitely, it definitely does, Juliet. Thanks for sharing your experience, because this is a topic that does come up a lot with someone with a mental health diagnosis, and saying, this is a mental health crisis, this is a mental health crisis. But as Aaron said, he didn't have a choice in certain situations. He has to treat it as a crime if one has been committed. So thank you both for talking about your experiences about that. So the next thing we're going to talk about is if your loved one is transported to an emergency room. So what can you expect when you're in an emergency room? Be prepared to wait. There can be some very long wait times, hours upon hours of waiting before your loved one is seen by a doctor. Admission is determined by the doctor. Bring all medical information, including doses of all current medications. And remember, this doesn't guarantee admission. This is for further screening, further assessment to see if your loved one is at risk of hurting themselves. Also, there are county crisis teams that can assist with triage, and that's only if they're available within your community. That would also help with what Aaron and Juliet were kind of talking about as well. Okay. So I want to review a little bit about kind of everything that we've talked about so far. We've talked about identifying triggers. These can all be preventative measures for for a crisis. So how can you prevent a crisis? So you're able to identify if your loved one is going to have a crisis. Maybe you can reduce any child or family stress. So if you know there's some stressors going on in the house, the environment may be a little unstable, how can you reduce that stress for your loved one so that they can avoid going into a crisis? Have a crisis plan. So like we talked about, being able to identify those triggers, but also when your loved one is not in crisis, have a conversation with them. Ask them what will help them when they're in crisis. What can you do as the caregiver? Is it better to ask questions? Is it better to take a step back? What is good in that situation? Also, there's something called a psychiatric advance directive that individuals with a mental health condition can have. And this is similar to a will, or an advance directive for someone with a physical illness as well, but with a mental illness, this is the psychiatric advance directive, and this can list all of their wishes. It can have a list of their medications, so that when they are in crisis, the hospitals can look at this to see what will help and de-escalate them during crisis. Develop a support system. So develop a support system not only for your loved one, but for you. You're a caregiver. What if your loved one doesn't live with you and you find out that they were hospitalized? Who can you talk to? Who can you go to? Who is your support system? And then also for your loved one, who do they trust? Is it a family member, a friend, their mental health provider? Who do you know that will help de-escalate and calm them during this time? Or if they're showing signs. Access and use available resources. I'll go over some available resources in a second. There is something called the LEAP method. So I have this book here. I know it is going to be backwards because it's in a camera, but it's a book by Xavier Amador, and it's called I Am Not Sick, I Do Not Need Help. This is a highly recommended book. I saw Dr. Amador talk last year at the NAMI National Convention, and it was very powerful. He talks about his LEAP method. And this specifically is to listen, empathize, agree, and partner. So I recommend to any family members or caregivers to read this book. And it specifically is how to help someone with a mental illness accept treatment. So I definitely recommend that. And lastly, collaborative problem solving. So how can you work together with your loved one to come up with a solution that's good for both you and your loved one? So as the family member, you might not like what your loved one's solution is, but how can you compromise, and work together to plan and prevent a crisis in the future? So now that we are in this pandemic, I did want to talk about some resources that are present for during COVID-19 that may be key if your loved one goes into crisis during this time. So the Department of Health did designate a support person to be essential to patient care for patients with disabilities where the disability may be due to altered mental status, intellectual or cognitive ability, communication barriers, or behavioral concerns. Hospitals are required to allow a designated support person to be with the disabled patient during hospitalization. So this support person could be a family member, personal care assistant, provider, but they can remain with the patient in the hospital. So this is really important for during this time. If your loved one goes into crisis, please let them know that this is a law. Also, screening centers. So I do have here that screening centers are open because they are essential, but it does vary from county to county. So for example, this link here, which you will have the PowerPoint, so you'll be able to click it. It has a list of all the screening centers in the state of New Jersey by county. But I did want to let you know that the Department of Mental Health and Addiction Services has authorized all screening centers in the state of New Jersey to conduct screenings via telehealth, either by phone or video. So it does, every single screening center has a step-by-step process that they need to follow to ensure safety, to make sure they're not putting anyone at risk for COVID-19 as well. An example, acute psychiatric services in Middlesex County is the first screening center in the state to standardize a process. So they have different steps that they need to follow, but they can use telehealth services as well. Juliet, I was wondering if you can speak a little bit about, I know in your county, you had looked into a little bit what they were doing during this time.
Oh, sure. Certainly. For Warren County, the county that I live in, they have still continued to do mobile screening. And so when a person calls the crisis number, they will dispatch a team, a mobile team, and that's how they've been handling their screening thus far, because they prefer not to send them and refer them to an emergency room because of the COVID-19 concerns. So I was told that they're using and implementing the person-to-person screening process. Of course, they're using PPE, and a police officer will accompany, but they've been, trained, and they're very sensitive about the nature of it. So they stand like 200 feet back and just try to be very reassuring to the person that they're there to help. So that's what's happening in Warren County. I want to go back to the former slide just a minute in terms of a tool to help to prevent crisis or provide support. And there's a tool that's called the WRAP, the Wellness Recovery Action Plan. And if your loved one could get a hold of that or have their therapist use that, that would be very helpful. I just want to just warn that it can be an intensive process because it asks some pointed questions. In the case of my loved one, in retrospect, we looked at it and it was just the answers were too general. And if I were to do it again, I would insist on being a little more probing with the answers. Another suggestion and word of advice is there's a section that designates who your support person is, what to do at a certain time or crisis. And it's very important that the person that they list be asked at that time. And so whoever is working with your loved one with this tool needs to, sit there and say, okay, let's make the call. Ask this person, will this person be here if X, Y, and Z occurs? And this is how you feel. Have you spoken to that person? So it's a very intensive process, but I think it will help your loved one to get in tune with what's going on with himself or herself.
Thank you so much. That's a really good, that's a really great resource. WRAP is definitely very effective. And I know there's definitely, in New Jersey, they're really looking to have a lot of individuals complete a WRAP plan because there's been a lot of success in this. So thank you so much for sharing that. Yeah. Aaron, did you have anything specific to share about also during COVID-19 and what anyone can do if their loved one's in a mental health crisis?
Sure, absolutely. And obviously I just wanted to start out with, if there is a crisis that reaches a level it's difficult for anybody within the house to take care of, we're still obligated to help. The police, the hospitals, the crisis response, they still have an obligation to help. So while it may alter the approach a little bit, it's not going to deter them from providing support for your loved one. And honestly, just general precautions. If you have to visit a hospital, if you have to allow the police into your home or somebody from a crisis center into your home, just keep your distance from them. Don't walk up to them quickly. If you have a mask, put it on, because we're required to wear masks right now inside people's houses. It's very difficult sometimes. Some people just usually have a tendency to get close to you, but don't take it personally if the crisis worker or the police officer backs up. It's just everybody's in kind of a heightened state of keeping their distance right now. So, but again, if your loved one needs support, they're going to still get it.
Thank you, Aaron. Okay, I just want to talk about a few more resources before we get to questions. So just wanted to let you know some COVID-19 hotlines and resources specifically for mental health. So there's the Disaster Mental Health Helpline. There's NJ Mental Health Cares. And also on our website, there's COVID-19 resources, and NAMI National also has a full COVID-19 information guide. Disability Rights New Jersey also has on their website, they have a lot of resources for individuals with disabilities and their rights during this time, during COVID-19. So this is overall some different important hotlines and phone numbers. I do know that that it's very small, but I wanted to fit it all on one page. But like Maggie had said, you will have access to the PowerPoint. And I do want to talk a little bit just about a couple of these hotlines and resources. So at the bottom here, there's wellness centers and respite houses. So this, like I have here, it may not be available during COVID-19, but I do know there are wellness centers providing virtual support. So they're having virtual events, virtual Zoom calls, so that adults who are seeking services can still have someone to talk to. Respite houses, right now I think do not have access because that does not support the social distancing measures. But this link that's down here, I will also have on our page with the recorded webinar and the PowerPoint. This is a guide to all the wellness centers and respite houses in New Jersey. The wellness centers under Collaborative Supports of New Jersey. So at wellness centers, just to give you a little background, there is services for employment, there's support services, there's a lot of social events, so it's great social opportunities for any of your loved ones. So going to a wellness center, hopefully when the pandemic lets up, maybe that's something that you can look into a little bit. Also, as you see, all these different hotlines, there's some specific for youth, like Second Floor. Vet to Vet is specific for veterans, Cop to Cop for cops. Mom to Mom. So Mom to Mom is, I really enjoy talking about this too, because this is a hotline specifically for parents, for peer support to mothers of children with special needs. So I've heard a lot of family members who have used Mom to Mom and have someone that calls them often, and just to have that person to talk to and be able to relate to on that basis. So I did want to talk about those. Also, for NAMI, there's a NAMI text line. So, that's something that can be used as well. Okay, so after all of this that we've talked about, a lot of information, I do want to let you know that you're not alone. You're not alone. There is support for you as a family member, as a caregiver at NAMI New Jersey. We have a lot of programs to support you. So we do have NAMI Family Support Group, which we are now offering online 3 days a week. It is statewide, even in person. It's in almost all 19 of our affiliates. This is for caregivers and family members of an adult with mental health condition. NAMI Family-to-Family are in-person classes. It's an 8-week course, and it specifically talks about treatment, medication, how do you talk to your loved one, acceptance, a lot of different things. And this is also available throughout the whole state of New Jersey. Most of our affiliates offer family-to-family. NAMI Basics is an education program for parents and caregivers of children with a mental health condition. This is available right now. There actually is Basics on Demand. So you can go online to NAMI National's website and you can take this course at your own pace, and it also covers similar topics to family-to-family. NAMI Smarts for Advocacy is a program where you attend a course that teaches you how to advocate for mental health issues, policy issues, how to talk to legislators, also how to tell your story. So to legislators. So for example, if you've heard about like the elevator pitch, that type of thing, but kind of how to tell your story quickly and efficiently to a policymaker or a legislator. And we do have 4 multicultural programs. So ACT Now, which is for African American community, NAMI NJ en Español for the Latino community, SAMHAJ for the South Asian American community, CAMPOP for a Chinese American community. They all provide support services for families and caregivers. And as you see it over here on the slide, this navigating a mental health crisis. So this will be available with the PowerPoint where you can click this link, and it is a 50-page guide and includes a lot of the things that we've just talked about over this webinar. So those are our services, and please, if you ever have any questions, please visit our website so you can see how you can find support for you because it's important to take care of you too as you're taking care of your loved one. So now we have about 15 minutes. I did want to save some time specifically so that Juliet and Aaron can speak, a little more, but maybe we can ask some specific questions that we've been getting. Maggie, do you mind asking some questions, please, if they're directed at any one of us?
Yes, we do have many questions, actually.
Okay.
So let's start off with some of the questions around the respite help, respite home. I know that Jen and Juliet both also mentioned. Can you speak a little bit more details about that, where people can find those? And is there a difference between adult and children when they need respite?
Okay, so when it comes to respite houses, I am actually more familiar with the adult system of care in this aspect. I do not think, and I'm not positive, but I do not think this is available for children because they are minors also. But for the adult system of care, there is respite houses. There's not that many throughout the state. We have talked on how to expand them because we have heard great success rates. In that link that I had, I'm gonna just go back for 1 second. Right here on the bottom, this will have the list of all the respite houses available in New Jersey, and that will be on the YouTube channel and on our website with all the resources. Did that answer the question, or did you want more detail on kind of the services of a respite house as well?
Yes, I know that there are 3 right now that state has funded, and they're looking to add more. But I think that so far that's the question. And I'm not so sure about during COVID-19. Jen, are you aware that if they are still open and receiving new applicants?
So as far as I know, respite houses are not running right now during COVID-19. Aaron, I know you spoke about that a little bit the other day when we spoke. Do you mind sharing a little bit about the respite houses?
Yeah, essentially, I can speak for Middlesex County, and I'm sure they're somewhat standard. A respite house is essentially somewhere you can go to kind of cool off. I know Middlesex, it's a 10-day, when you're accepted, you're there for 10 days. And while you're there, it's essentially just a place to be that's, not your normal environment. They have therapists there on site. You almost treat it like your own home. And it's I think the triage is done over the phone. And, depending on when it is and where it is, there could be a waiting list. Again, I'm not an expert on this. However, I have had interactions with the people who work there and people who've stayed there. It's essentially just a place to go cool off. And I know right now it's not open in Middlesex County, at least, but they do still offer support services over the phone. And if there's anything that's more appropriate for somebody during this time, they will steer them to that.
If I may add as well,
Go ahead.
They are up functioning. If there are no beds available, because a person can stay there for up to 10 days, but if there are no beds available, they will send someone to the person's place of residence in order to provide that kind of service. Okay, so instead of having to go to a hospital. And also another condition is that this service is available only to those who have housing. So if someone is homeless and is suffering with a mental illness crisis, that person will not qualify for this service, unfortunately.
Thank you, Juliet.
Yeah, just one more comment, I'm sorry, Maggie, but I did visit a respite house during the crisis intervention training, and it is a very cozy, positive environment because it does feel like a home, and you don't feel like it doesn't feel like that hospital environment. So I did want to share that by visiting one, you can really, it is basically like going to a different house for a few days. So just to kind of de-escalate and be able to maybe gain some coping skills. So I think that's really good. Thank you.
Okay, thank you. Another question is that what happens if there is no CIT in your town or county? Maybe Aaron?
Well, the classes, so CIT for New Jersey is as a whole essentially run by the state, but every county has the freedom to operate independently as far as how the class is given. There are certain things that are standardized throughout, but from county to county there are differences. And depending, it's one of the few specialized trainings that we have as police that's 40 hours long. So it's, at the time I saw one question, it's not mandatory right now, but it is something that, and it does, having somebody go to a class for 40 hours does put a drain on resources for some smaller departments. I can only speak for Woodbridge, but losing 5 guys for 40 hours is not as detrimental to a smaller town that might only have 60 officers and can only send 1 or 2 people at a time. Right now it's mostly run twice a year. Again, speaking for Middlesex County, I know Union County does it 3 times a year, but it's not mandatory. And if you don't have it, you can approach your police department and ask them, if they've sent people, if they've been interested in sending people, maybe you can find a point of contact at the police department, essentially spark some interest. And, we get some community members together and say, listen, we'd like to have more CIT officers trained in our town. Is it possible? Pretty much starting the conversation is a good way to go.
Thank you. And we have a couple of questions about what if the law enforcement officers are a trigger themselves for the loved one? What to do, and any comments on that scenario?
Yes, I did see that question. My advice would be to proactively seek out the police in your community. If the police is a trigger, maybe when your loved one is not in crisis, try to meet some of the police officers in your town or something like that. Call up, find out why they're a trigger. Maybe it's because they had one bad experience with a police officer, and that, from then on, they thought that every experience was going to be like that. When there's an emergency, the police are the ones that come. There's no question about it. Mobile screeners and crisis centers usually come, and when they do, they're usually accompanied by a police officer. So if a police officer is that big of a trigger and you've tried things and they just, every time that a police officer shows up, it gets out of hand, maybe you ask the crisis counselor to leave the police outside and only come in if there's an emergency or something like that. But again, in an emergency situation, the police are the ones that are coming. So I would say proactively try to get your loved one to get as comfortable with the police as they can when they're not in crisis.
Thank you. That's a great answer, Aaron. Just a short one about whether or not people can call the crisis intervention services while dialing the 911. Is this something that you suggest?
You mean either or? Like, if it's either or, it depends on the level of crisis that your loved one is in. If their level is so high that you believe they need to be, stabilized, and then somebody's going to have to use some sort of force to stabilize them, then that's where the police come in, because crisis, counselors, mobile screeners, they don't use force. That's why we oftentimes accompany them. But if it's something you see building, that it's not at a level of an emergency, then I'd say that the mobile screeners or crisis counselors would be more appropriate at those times.
Thank you, Aaron. And there's a parent who asked, so if my 19-year-old son has punched holes in the walls, is that, that's considered a crime?
It is considered a crime. It's criminal mischief, especially since they're an adult. Depending on, that usually wouldn't be the only factor that's considered in how to handle the situation. It would be a host of other things. Are they calm now as opposed to before? When they punched a hole in the wall, obviously they were in some sort of crisis. When we get there, if they're a little bit more calm, you can handle the situation a little bit differently. But a crime like that, usually when I should have clarified, when I say mandatory arrest situations, it's usually for some sort of an assault.
Thank you. And also maybe to Jen and Juliet as well. Are there any important differences between crisis planning for a minor versus an adult?
So I think to answer that, crisis planning is different for every individual. I think every individual has their own unique crisis plan that works best for them, whether it's a minor or an adult. So they may look similar in the way of a safety plan or what works for them with coping skills or support system, but it really is individualized within the crisis plan, and it's worked on. It can be between a provider and the family member and the child or adult.
If I'd like to chime in on that, whether it's the loved one is an adult or a child makes a big difference because of HIPAA laws. Once a child matriculates into the adult status, then the parent is at the mercy of whether their child will allow him or her to be a part of his, support team. And so in those situations, what we've learned is to try to get as much information as possible from your loved one in terms of who their therapist is, who their doctor is, and other friends and close associates. And with regards to dealing with the professionals in the medical community, the provider may not be able to say anything about your loved one, but if your loved one is in a crisis, that doesn't prevent you from sharing with them what you know. And that is the most important thing, because at this point, you want to ensure that your loved one is getting the best medical care possible. And the provider cannot do that without appropriate information. And if you've had a history with that loved one, you're in a position to help. So I would definitely encourage and advocate for a caregiver to just be bold and proactive in that case. And I'm going to read that book because I could probably learn a lot from him.
It's a great one. Yes, thank you, Juliet. Yes, and also online, there are a lot of participants saying that they had good experience with mom to mom. So that would be a great resource for young parents, young families with minors. And also for adults, we do have a very unique New Jersey program that Jen mentioned is IFSS, the Intensive Family Support Services. So those are wonderful free support for us. Now, there comes a question about emergency rooms. So the law allows support persons to stay in a room at the hospital ER during intake and stay. Is that true? What if they are moved to a crisis unit? And what if the loved one actually, because of the crisis and diagnosis, they would say yes, and then they would change their mind, say no, and then they would say, oh, please stay. So what's your comment on that question?
So I just want to make sure I'm understanding the question correctly. So the person's asking if they are admitted into the crisis unit and the loved one is saying to stay or not stay, and there's some mixed messages? Or what? Sorry, do you mind repeating it a little bit?
Yeah, it seems like it, because there are two questions. One is that whether or not the support person is allowed to stay in the room at the ER during the intake process.
Okay, so this does vary. I think if it is an adult or a minor too, because of what Juliet mentioned with HIPAA as well. But the support person, as far as the law says, we can include that as a resource as well, is that the hospital is required to have the support person present during the specific intake process. I don't have that specific answer, but looking into that, into the law, we can identify that for you.
I can speak a little bit about the crisis centers themselves. I know the ones in the hospitals, as well as the ones that operate outside of the hospitals, they're usually secured areas, and the only people in there are the patients themselves and the ones who work. Even when police officers bring people in, they're required to lock their weapons up. So as far as allowing somebody into a crisis like unit, even under normal circumstances, they're usually not accompanied by a family member.
Thank you. Yeah, I think that there's some clarification here also. So the question about the loved one changing their wishes, you know, the person may have a disorder that has, you know, that may cause that. So the parent would like any comment on that scenario.
Yes, there is another documented tool that's very helpful to if you had prepared it with your loved one, and that is, oh gosh, it was an advanced attorney. It's what? Jen, help me with this.
Is it the Psychiatric Advance Directive?
Yes, but it's where power of attorney.
Power of attorney. Okay. Yep.
The power of attorney.
Yes.
And you can have that notarized and in place before the crisis. Then that overrides any other, you know, conditions, because when your loved one is in that state, he or she is not thinking clearly. And so that's when that power of attorney stays in effect, and it is effective during that time. So then, you know, that will mitigate some concerns in terms of whether law enforcement will allow you to legally be with that person or whatever. That power of attorney is the final say at that time. So.
And I did want to mention with also the Psychiatric Advance Directive, we will be having a webinar on that specifically in the near future. So please attend that if you are interested in learning how to create one with your loved one.
That's wonderful. Yes, because there's a question about that one. So,
and also, you know, the power of attorney is helpful because your loved one may be out of commission for quite a while, and so bills are coming in and all types of things. So, you know, the power of attorney will give you the legal right to access his bank account or her bank account, and take care of some other things that need to be, that may go into arrears otherwise.
And also with the power of attorney, there's also within hospitals the release of information. So that's also a form that can be filled out and gives permission to share information with certain people. So whether it's family members, the client can sign one. Your loved one can sign a release of information if you don't have a power of attorney.
okay. Also, I have a question about what do you do if my loved one has some financial means and is smart, and when in crisis, they threaten the facility, they will sue, and, you know, they can cut her loose. So some hot potatoes scenario. If Juliet wanna comment on that.
Well, in that particular scenario, I'm not an expert now legally, but it would seem to me that if a person is is being hospitalized for, you know, that diagnosis, that you know, that would not be a concern. Although the policy is if a person is admitted, there's a 3-day time in which they're evaluated. After 3 days, if they appear before a judicial or a judge to evaluate the situation, if there is no medical evidence that that person needs hospitalization, then that person will be released. That's the law. So again, so it has to be determined that there's a medical need to stay in the hospital. So I wouldn't be too concerned about, you know, potential lawsuits at that point. That's my opinion. I'm not a legal expert, but yeah.
I can touch on that briefly. I know from a police standpoint, you know, in service of our, you know, in service of the individual while doing our job, if our intention is to help, we have something called qualified immunity. So we cannot be held civilly liable for anything that happens. And I'm going to imagine that crisis centers and doctors and anybody who works in a hospital, I imagine they have something similar to that. Don't quote me on that. We'd have to look into it a little bit more, but I would imagine that they are also immune from civil liability if their only goal is to help.
That's great.
I just want to speak to something, and then that has to do with a broader issue about just how we care for people who are in, you know, who are dealing with a mental illness, and the level of compassion. And there's so much involved. A lot of has to do with monies and overstaff. And we can always improve. We really need to improve the conditions that are in the hospitals. And so I have a great amount of empathy for those who are hospitalized, because you know, I was hospitalized for a gallbladder surgery, and the conditions that I was under is not the way it is in mental hospitals. And unfortunately, and there's so much disparity, and we need to have parity in that area. So I don't want to minimize, you know, a patient's concerns.
Thank you so much. I think that we do want to be mindful of our time. We overrun a little bit. So I do want to mention that the document on our website, the crisis guide, will answer a lot of the unanswered questions here. And definitely in the feedback form, you can put down some questions as well. But Jen, Juliet, and Aaron, thank you so much for joining us and sharing with us these valuable information and resources. Okay, and to our participants who are affected by mental illness and crisis episodes, we want you to know that you are not alone. This is not your fault. You deserve help and support, and there is support available for you at NAMI New Jersey. Before we close the webinar, I'd like to share with you the online services that you can find from our website. So from our front page, if you go to our Get Involved page and then click Become a Member, you can find out about how to become a NAMI member. That said, all our programs are free. On our front page, you can go to the COVID page where you'll be able to access all our services and resources. You'll find where our statewide online support groups are, affiliate support groups, multicultural programs, signature programs. We have a lot of webinars going on there. And also the webinar series, which is like this one. So here we list all of them. The replay will be posted here along with the resources that are mentioned. So Feel free to reach out to NAMI New Jersey for any support you might need. So thank you again for sharing this hour with us here today. As a reminder, it would be appreciated if you could complete the survey at the end of this webinar so that we can incorporate your feedback for future webinars. This will conclude our webinar. Thank you all.